My name is David Frenz. My role here at Health East is I'm Medical Director for Addiction Medicine. And the question about time here is a little tricky. I've been employed as a physician here since 2005, although I was a medical resident here starting in 2001. It's kind of okay to say here at Health East, but there's this biblical saying, it's not the well who need a doctor, but the sick. I just didn't feel like I was really treating anybody who needed me as a family doctor. I was out in a suburban part of Minneapolis, and if I got in a car crash on the way to work, people would have been upset that their appointment got canceled, but I'm not sure that that visit was critical. Their life would have ended if I hadn't made it to work. But here there is that sense of purpose, that these patients, in a way, need us, and that it is some way vital to their functioning. Specifically our department, which is a mental health department, if you look at it financially, it operates at a loss, but Health East has consistently said this is so important to our community, our culture, our patients, that we're going to do it. We're going to fund it at a loss. And so a corporation that's willing to make that investment because it's the right thing to do, I think speaks volumes about the organization. A lot of medicine is storytelling. I get to share in people's stories. I get to sit down and hear about people's lives and share their narrative with them, and they incorporate me into their story. Eventually I'm part of the narrative. They'll be telling their story to somebody else in the future, and I'll have a bit part or a character role in their story. In some ways I'm like a spiritual director masquerading as a doctor. It feels that way sometimes. You're getting the essence of what it is to be human struggles, meaning, purpose. And I do doctor things along the way, but that's kind of the story, the narrative, the intent, the journey. People think, it's funny, when people realize what I do for a living, they assume that the outcome we're looking for is the cessation of drug use. And that is such a small way of looking at people. So when we talk about successes, it's great if they stop using substances, but that's just the beginning. So the successes we're looking at, do they become more fully developed as humans? Have they reached their potential? So the successes I think about are people who are not using substances, which is great, but they went from having big legal entanglements, dysfunctional relationships with their kids, unemployed, stuff like that, to having stable housing. They're meeting role obligations with their children, they have jobs. Those are the exciting outcomes for me, to see that journey. Well, the thing that's nice about Health East is it began as a Catholic organization in 1853. So spirituality, however you want to define it or construe it, has always been part of the culture here. And so those of us who sort of think in spiritual terms, it's kind of okay to do that here. You don't have to sort of worry and say, well, gee, I wonder if I'm going to get in trouble for dabbling in stuff that isn't traditionally the purview of medicine, stuff that's traditionally the purview of spiritual directors or psychologists or clergy or stuff like that. So we are looking for a bunch of people in our department. For addiction medicine, we look for people who have good primary care background, typically family physicians or internists, who are also interested in mental health and sort of the bigger picture that goes with mental health. And then we're also interested in psychiatrists that have formal psychiatry training. Patient-oriented again. Are they focused on the big picture? Maybe a sense of their own struggle. I mean, it's not a prerequisite that you've had a horrific thing happen to you, but that you've struggled through things in life yourself and learned things from it, and you can empathize with people who are struggling. And so that, again, when you enter their narrative and become part of their journey, it's not completely abstract. There's a big change in healthcare going on right now called accountable care organizations. And we've been making the right decisions for our patients in our department for many years and redesigning care delivery. Well, it's completely congruent with accountable care organizations. So we're kind of pleased and amused that suddenly everybody is interested in what we're doing. The board of directors had us present to them about what we're doing, and oh, by the way, that's completely congruent with ACOs. So there's been some nice surprises that way.